Our first speaker is John Jakicic. Dr. Jakicic is the director of Healthy Lifestyle Institute and chair of the Department of Health and Physical Activity at the University of Pittsburgh. Welcome, Dr. Jakicic.
Great, thank you so much. I appreciate that. So I've been asked to speak about some of the work that we're doing in the integration of systems and around the sectors of mostly in the area of physical activity, and give some examples of the field of where we've been working. As I get started, just want to disclose a few things. I have research funding through the NIH, UPMC Enterprises, which is our medical center here. I'm on the scientific advisory board for WW International, which is formerly known as Weight Watchers. And I'm also a clinical advisor for a company called Spark 360. So as I thought about my presentation today, I really wanted to take and put things into one of four, what I'll call buckets, that are across systems that we've been working in, primarily in the area of physical activity, but it's now broadening beyond physical activity, but I'll use physical activity as those examples. And to really think about the work we've been doing as kind of a living laboratory that we've been working through to try to take what we basically have done in these research studies and how do we take those and get those translated out, but then consider what do we need to think about when we go out and try to translate these types of initiatives? What are the other parts of the systems that we need to think about that would make these actually applicable? And that's actually not been a challenge, but it's actually been an eye-opening experience because we've learned a lot when we've gotten out there. Some of the things we knew about, some of the things we had no idea about when we got there. And I'd like to share with you some of those thoughts and ways of thinking that we've been kind of dealing with over the last period of time. And it's actually been enlightening to notice in our work that a lot since COVID-19 has actually changed our way of thinking as well in terms of how these systems need to be thought about. So my examples will be mostly around the area of physical activity. And I'd just like to start with, where we've been with our research and center-based activities related to physical activity in the space of obesity treatment and in the space of obesity and weight gain prevention. When we start to look at that, this is what you see. This is what you think about. You think about, a lot of equipment. You think about doing these very classical measurements to see how things are changing in these controlled laboratory settings. Randomization occurs. Individuals, have to be willing and time committed to actually participate. And while these are really important studies for us to understand, in some case, efficacy, in some case, effectiveness, these are really not real world. As many of you know, in these studies, we have eligibility criteria. We may be excluding people that are not fully representative of the broad population that we're interested in, but it gives us some signals of things that should be working or could work out in the broader space. But these are really just kind of the beginning of that. But I also want to highlight that sometimes we need these laboratory studies to understand what we're seeing in the field. So, a lot of our work has used these lab kind of hardcore, well-designed, randomized trials to start to form the foundation of what it is that we feel needs to be translated into these systems. However, as we have been getting into that, we've started to think, and I'll use our university when I say institution, how do we take what we're doing within our research settings and start to apply that to what I'll call an institution? And my examples will be primarily around the institution of our university, because we have 15,000 adults that work at our university. Not all of them are professors. It's a diverse group. As every other university, it's broadly speaking. And how do we start to think about what we're learning in these research environments and try to think about how do we even integrate the system that's close to our heart, the thing that we think we know the best? You would think that this would be the easiest translation into these systems. And when we start to think about those things, the first thing that pops up, and the first thing is we start to survey individuals about, so here's what we have to offer. What is it that you feel what would you need to support your efforts when it comes to physical activity? And the first thing we hear broadly across our university is we want to target exercise, not physical activity, but people talk about targeting exercise, which is very different than physical activity. And then the first thing that bubbles up is we want a new recreation center. We want more gym space. We want more treadmills. We want more weight training equipment, so on and so forth. And what you really learn very, very quickly is that all sounds great from an exercise model. But when we looked, and I looked at this a number of years ago, and we continue to look at it, the number of adults at our university that actually utilize these fitness centers is a very, very small percentage of the overall population at our university, at our institution. It's a small percentage. If we have 15,000 employees, we might get 500 of those employees using these fitness centers on a given day. That's a very small number, an important number, but a very small number. But it's a very big investment for us to be thinking about. Now, these have been built. It's a big investment. But what about the other 14,500 individuals who we're not touching through our initiatives? How do we touch them? And what about the system do we need to really be thinking about that's actually going to allow us to reach them, understand their needs, and integrate them into a more physically active lifestyle through the institution of our institution? So that has caused us a number of years ago to start to think more broadly. And we started first and foremost not by doing a research study. We first started by saying, let's get out there and start to do things that actually we feel are going to touch the broader group, with some feedback from that broader group as we went out there. Understanding that the vast majority are not using fitness centers. So our university has shied away from the fact of we're going to build fitness centers on multiple layers of our campus. And if you're familiar with the University of Pittsburgh, it's kind of flat, but on a hill. It's spread out throughout the city of Pittsburgh, which is the Oakland community. We would have to have multiple fitness facilities on this campus to put them close by to everyone. That's a huge expense for us. And our data didn't suggest that even if we built them, they would come. So we started to think about, how do we touch the other individuals? And why would they not come to those facilities? And what we learned very, very quickly is individuals who are not engaging what we'll call exercise are very intimidated by that. So we went out and asked them, why is it that you're not doing this? Some of them are using other facilities, but they're like, I'm afraid to exercise. I don't want to be in that space where other people know what they're doing. I don't look good when I'm there. Exercise, I just don't like doing that. So then when you talk to them and they're like, I will do other forms of physical activity. And so how do we actually take this kind of wellness model of physical activity and use our institution and our system within our institution to touch these individuals? So we've actually looked at a couple of other ways to think about this with the feedback of our participants, of our faculty and staff, actually. So the first thing that we did was we thought about, how do we build a community of physical activity? And we felt that if we could build a community of physical activity within our own institution, we would learn something about how do we build a broader community of physical activity that's actually going to touch our community around our university and in our city. However, if we couldn't build a community of physical activity within the people where we thought the uptake would be the greatest, then that's going to tell us something about how we go out there and do this on a broader scale within a much more complex system. So let's build it within a system that we think we understand. And we started to do that. And we found that things like making people feel that they're part of something, along with people who are just like them, really made a difference for them. So we created this initiative called Be Fit Pitt. We're lucky that it actually rhymes with our university, the University of Pittsburgh, so it worked for us very well. But now we have individuals, wearing these shirts around campus. These are people who are not regular exercisers, people who want to be a part of this community in a broader sense, because it doesn't mean I need to go to this facility and be an exerciser. It means I need to move around and start to think about activity from a healthier lifestyle perspective. So it was a very eye-opening experience about how do we start to build community. And so we thought about this kind of concept. Within that, we also then thought about, well, if we start to build interest in the community, how do we activate that community? It's one thing to get people excited about physical activity. It's another thing to actually activate them within the systems. And so what we started to think about then was, what are the kind of initiatives that actually can work to get people engaged. And what we learned, and this is where it's important to go back to the research we did in the lab, we learned very early on in our research that for individuals who are underactive or sedentary, however you want to define them, and you're trying to engage them in physical activity on the way to more maybe of a structured exercise program, they needed to have something new introduced to them every 8 to 12 weeks. If we just started something and just left it out there, within about 12 weeks, the interest started to just fall off the edge of the table. And they needed something more, they needed something different. So along with our faculty advisors and our students, we have created, and they're doing all the work. I'm not taking credit for this. They're doing all the work. Well, we've created not challenges per se, but actually programming opportunities for engagement. So for example, February flights, what do we mean by that? Well, we have the Cathedral of Learning at the University of Pittsburgh is the tallest academic building in the Western Hemisphere. And so we have 36 floors or something like that. And people use those stairs to walk up them. We created a system where, how do we train people to actually think about February as a way to start using the stairs within that Cathedral of Learning to start to build their efficacy for physical activity? We built something around the Halloween holiday, Spooky Strides. We played off of the bucket challenge, the water bucket challenge a number of years ago, where it was a give me five, where just give me five get out of chair stands, just give me 5 wall push-ups. And we started having groups of individuals across the campus challenging one another in a fun way that became engaging, but it wasn't exercise. And it started to catch on. So it was about build community and find ways to creatively activate that community on an ongoing basis that allows for, don't just build it, but you have to build it and allow it to modify over time. The other thing that we've been doing, and this is since, a little bit before COVID, but now COVID, is we realize, at some point in time, what we also need to be thinking about is, how do we reach those people who want to engage in a more active lifestyle, but still are intimidated by a fitness center, still are intimidated by structured exercise? How do we build a system? And so what we've done is we've now started to do opportunities where there's remote opportunities for people to engage. We have an entire library of videos and also live streaming. But what's nice about that is that the person participating doesn't have to be on camera. They're not being seen. They can participate behind the scenes, because we learned in that system that while they want to engage, they don't want to be seen doing it. They're intimidated by that. So how do we use a system of remote technology to actually bring this to the masses? And what we're learning here is, how do we now take this and bring it to the community as well? So we have this thing called Pit Live Wire Live, where we're actually to stream these activity sessions. And through that, we're now actually able to take it outside the university into communities, underserved communities primarily, where they still have access to things like Wi-Fi and maybe a computer, where they can actually access this. And we're getting great feedback where they're engaging their entire families in how to do these things. So that then leads me to my last couple of comments, which lead us to, how do we start to now think about this in the community? So it's kind of an integrated model and an integrated system. So, the first thing that everybody thinks about is, how do we make these wonderful facilities available to everyone? So the first thing we did was we went out into the community. Where are these facilities at that some people want, and what do they look like? And I can tell you that the communities where this is needed, not the most, but needed in a way that we actually can have a huge impact, don't have facilities that look like what you see on this screen. They're much smaller. They don't have this updated equipment. They're dirty, they're dingy, and people just don't want to go there. So while we have these community centers, they're not appealing to people. So how do you build a community of activity when what you're seeing around activity just doesn't seem very good for people? It's not engaging them in any kind of major way. How also do we start to think about activity across different levels of people and different levels of fitness? We're doing this through some of our own work where, instead of saying, this is how you do it, we're having people being able to model people that start to look like them and have fitness levels like them. If you need to do it in a chair, you can be active in a chair. If you need to do it standing up, you can be active standing up. And these are exercise, but we're doing this also just with general physical activity. How do we actually use the systems that we have to actually match where people are, as opposed to saying, everybody's going to be the same when they start. It's not that way. They may not be physically ready. They also might not have the self-efficacy to be ready to engage in this way. And how do we make things accessible? Our grandiose idea was, okay, we're going to stream all of this stuff to these communities that need it. Now we realize, yeah, there's a segment of the population where that's accessible, but what if they don't have a computer? Especially with COVID-19, that computer, the one they have, is being used by their child just to go to school. Their internet capacity is not there. So all this technology that we have is wonderful, but within the system, we need to make sure that the system that we're trying to use has the ability to leverage the technology the way we're thinking it can be leveraged, as opposed to saying everybody has multiple computers, everybody has high-speed internet, everybody has a camera, everybody has audio, so on and so forth. It's not that way. So we really need to start to think about these systems as, how do we get also to the lowest common denominator? How do we get to the people that don't have all of these things that we're thinking about when it comes to this? And the other thing is, how do we really partner with the communities? Within our systems, we think about the University of Pittsburgh as a system, but we also have communities around the city of Pittsburgh that have their own systems. Each little neighborhood is its own system that we need to think about. And building sidewalks in one community may not be as effective as building sidewalks in another community. Those types of things are really important. So our university has started these community engagement centers where we're actually going into the community and having space there, but also now we're partnering with the community. We're engaging with that community. We're having discussions with that community. We're not going in and doing research with that community. We're engaging with them. We may get research out of that, but we're not starting with research. The research we have is really feasibility research and trying to understand what they need before we build it, just because someone said that would be a good idea. We're trying to understand, is that the good idea for that community? And these two communities here are primarily minority-based communities in Pittsburgh, Homewood, and this is the Hill District. This is actually Freedom Corner. It's basically a historical landmark in our city that's up in a largely African-American community around how this community engages, and they rally around these things, and how do we use the systems that those places already have in place to encourage this behavior that we're actually talking to people about? How do we build these systems is what I'm saying. Okay, thank you.